Hi, everyone. Welcome to Mental Health Colorado's Legislative Lunch Break webinar series. This will be the final webinar of the 2026 legislative session. And we just want to thank you for staying engaged and hope that you've learned more about the legislative process and how advocates and lawmakers are working to promote healthier minds across the lifespan for all Coloradans. Um, my name is Ashley Perales, and I am the host for the webinar. If you have any questions, you can drop them into the Q&A, and we will answer them as we are able. And with that, I will pass it to Vincent.
Hi, good afternoon, and welcome back. I'm Vincent Atchity. I'm the President and CEO.
Hi, everyone. Thanks for joining us. Wendy Buxton Andrade, Vice President of Government Affairs.
So in case you haven't heard it before, Mental Health Colorado advocates to promote healthier minds across the whole lifespan, from start of life until its end and every point in between. And what we do is we work to pass laws, change practices, and build a movement. It takes all of us to improve the health of our community, and everybody's got a role to play. So we're going to go by way of review through the bills. We've had a pretty satisfying legislative session this year. As we knew going into it, nothing too dramatic was anticipated due to the fiscal constraints of the state, but we forged ahead in any case and achieved a bunch of worthwhile objectives, and out of the gate want to applaud the work of the partner advocates and the elected officials for passing Senate Bill 60, the Youth Athletic Coach Mental Health Education Bill, which we are referring to as Alyssa's Act, in honor of the young woman who died by suicide as a consequence of athletics-related concussions. And Wendy, why don't you say a few things about what this bill achieves for us?
What it does is it puts in statute, so as administrative changes happen, this puts it in statute that it lives on forever. We will have, it will link together our concussion protocol that is already happening in youth sports, to the mental health training that also happens in youth sports. Now it links those together and shows coaches, as well as youth athletes, parents, that a mental health crisis can come out of a concussion. And it asks the coaches to be aware and make sure that they talk to the guardian and parents that after a concussion to watch their child, for mental health consequences. As we all know, we see teenagers go through hormone changes and everything else. And a lot of times people miss the signs of a mental health condition. So this bill will link those two together and make our athletes stronger in the long run, and maybe have some positive outcomes with linking those two together and making sure that people, as we always say, it takes a village to raise a child, and we want to make sure that village has all the knowledge that they can.
The next one we're going to mention is House Bill 1043, Transport Network Company Discriminatory Practices. Working to end health-based discrimination is a key focus of our advocacy, and this bill addresses concerns by folks with various health needs and disabilities who've experienced discrimination on the part of the transportation companies that will sometimes take a look at somebody or their companion animal or the presence of their cane and drive off and leave them abandoned there on the side of the road to avoid some perceived inconvenience. This bill addresses that and steps up the ability to report those refusals and steps up the penalties for that as well.
This bill was signed in to law on May 20th by the governor already. So we're excited to see some of these strengthenings of penalties because I can't imagine being stranded in the middle of some of the areas that they were leaving them in, pickup areas, and people not being able to get rides and having to wait an hour to 4 hours to get a ride to their next destination. And nobody should have to go through that, and especially those with disabilities.
House Bill 1195 passed as well and was signed into law. This is psychotherapy artificial intelligence restrictions. This is a bill that protects consumers from being cared for by the artificial intelligence agents out there rather than by credentialed humans who have been trained to support human health and well-being through their therapeutic practices. This is an important protection. AI is not a reliable provider of care. There have been innumerable instances of poor outcomes associated with reliance upon AI. I was just reading about how something like 1.2 million exchanges with ChatGPT have been related to suicidal ideation. That is not a safe space. AI is not a safe space, and this puts a little bit of protection in place while preserving the ability of providers to integrate AI safely into their record-keeping practices or their back office practices in a way that is not consumer-facing.
This bill was passed on the House floor on May 12th. It is waiting for the governor's signature. This bill definitely is one that we watched for artificial intelligence, had many conversations with the representative that brought it forward. She is one of our champions, Representative Ryden. And we were happy to support this bill because it strengthens our system and protections for the consumers.
House Bill 1325 also passed and was signed into law. This is a natural medicine bill specifically focused on research into the use of ibogaine for a number of different conditions. Ibogaine is among the natural medicines, one of the ones that needs a bit more clinical oversight when it's being implemented, as it may have implications for cardiovascular health. This establishes a research pilot program within the BHA so that we can take steps toward making ibogaine accessible in a safe way to the individuals whose health may benefit from access to this powerful natural medicine.
This one is sitting on the governor's desk right now to be signed, and sitting on the Natural Medicine Board, this is ibogaine was one of the natural medicines that when that ballot initiative passed. And so this is the next step and making sure that this has protocol around it to keep those that want the benefits of ibogaine and making sure that they are protected and that it is has policy around it. And those that administer it have training.
Senate Bill 113 also has successfully passed, and this bill requires recovery residences to obtain a BHA license. This is an important bill for consumer protection because it gives the BHA greater capacity to impose restrictions on practices which are not compliant with regulation. This is a step that the state is taking toward ensuring that peer support services, which is a key feature of many recovery residences, remain available, but in such a way as to ensure that the necessary consumer protections are in place.
This bill has been signed into law by the governor on May 20th. And we testified on this bill because Mental Health Colorado a few years ago ran a bill to be able to regulate it, but it did not have the license behind it. For the BHA, this will allow them to do the licensing and make sure that when there's bad actors in this field, that they actually can issue cease and assist orders and make sure that they protect those residents in those recovery houses.
Senate Bill 6 also succeeded, and this is parity for non-opioid pain management drugs. This is an important step in reducing potential harm for drugs and alcohol in the context of the opioid epidemic that continues to ravage populations in Colorado and nationwide. What this does is it establishes a parity requirement that insurance coverage be available for non-opioid pain management medications in the same way as it's been available for the opioids. It opens a pathway to being able to use substances to manage pain that carry much less risk of addiction and overdose for that matter.
This bill is waiting for the final signature from the governor. What strikes me as this bill is we all talk about the harms of opioids and needing to make sure that there's alternatives for people that are struggling with opioid addiction. And one of the things that we heard during testimony is when you go in for surgery, having an alternative, and the doctors having an alternative to opioids for pain management. And so this bill actually opens that up and makes it less restrictive with the insurances and pairs it just the same regulations for non-opioid as opioid pain management. So we were happy to be one of the people that supported this.
Also included under reducing potential harm from drugs and alcohol, because of its addictive aspects, Senate Bill 131, Sports Betting Protections, passed. This is a bill that acknowledges that sports betting, which was legalized by ballot measure in the state of Colorado, does not continue to ravage the health and well-being, particularly of young users. The mechanisms for enabling sports betting to take place on mobile platforms is designed, as so many of the mechanisms on our mobile platforms are designed, to be super addictive and engaging. And as a consequence, people drive up enormous debt and experience exacerbated stress, risk of suicide, all kinds of other poor health outcomes. So this bill puts some protections in place to limit, as a way of limiting overuse, harmful overuse.
This bill was passed both floors on May 13th. It was sent to the governor, and we're waiting for his signature. And this kind of was one of the ones that Colorado ran, and on a ballot initiative, the voters approved this. But once it was in statute and constitutionally allowed, they found out that they needed to put some parameters for protection of those people that possibly could get addicted to the online betting. And that's what this bill does. It makes sure that we don't have the potential harm for those that, um, we all have our phones. It gets constant pings, and this helps with some of that and protects those that could be harmed.
Uh, Within our focus area on supporting wellness in aging, House Bill 1110, Vulnerable Adult Financial Exploitation Banking. This bill also succeeded, and what it does is it puts some additional protections in place to protect vulnerable adults from financial exploitation. Um, Vulnerable adults are often subject to fraudulent behavior through the various mobile platforms and electronic platforms that we use. This creates a bit more protection around the disbursement of funds and accelerates the reporting of suspicious transactions.
This was signed by the governor on May 20th. As we all know, elder abuse happens. There's protection in human services. This allows the financial institutes to also protect when they have one of the um, larger withdrawals on an elderly person's account, so we can make sure that life savings don't go out to fraudulent scams. And so this is definitely a protection for all of our loved ones that are aging and need that extra protection.
Right. Thank you, Wendy and Vincent, for going through all the bills. We wanted to share a couple upcoming opportunities to engage with us and the community. This year, we've partnered with the Colorado Rapids. This will be our fourth year partnering with the Colorado Rapids on Mental Health Awareness Month, and there will be a game tomorrow, Saturday, May 23rd at 7:30. If you use this QR code to purchase a ticket, $5 of every ticket purchase goes right back to Mental Health Colorado. So we hope to see you there. We'll have a booth, so if you make it to the game, come say hi.
Let me just mention since it's Mental Health Awareness Month, that this week we've got the Civic Center in Denver, Ball Arena, and Meow Wolf have all lit their facades up in green to honor the month. So if you're downtown in front of any of those venues and think to take a selfie, send it our way and we'll include it in our social media.
Yes, thank you, Vincent. Oh, I'll let you talk about this one too.
Sure. So this brings our legislative lunch break webinar series to an end, but we're going to carry on in a different vein starting 2 weeks from today on Friday, June 5th, with a new series of interviews and conversations with remarkable people doing remarkable work to advance health of mind in Colorado and beyond. Same time, same channel. Please join us and share with others. Our first guest on the 5th is going to be Jonathan Singer, former member of Colorado State House of Representatives from the 11th District and long-term health champion, now serving his community in the Boulder Chamber of Commerce. I look forward to conversing with Jonathan and hearing what he's got to say. He's a powerful champion for our work.
Great. And then we will also be hosting a 2026 post-legislative session celebration with awards and happy hour. You can use this QR code to register for that event as well, and we hope that you'll join us.
Yeah, and stay tuned also. We will shortly be issuing this year the 2026 legislative report and scorecard, in which we will summarize the work of the session as well as issuing those scores where all of the senators and representatives are graded essentially on how well they've shown up for the mission.
All right, we want to remind you to join the Brainwave if you haven't yet registered. This will be your opportunity to stay engaged throughout session and throughout the year on different opportunities to advocate for health and well-being in Colorado. And if you have any questions or any follow-up or have any thoughts, please email me at aparalis@mentalhealthcolorado.org. We definitely would love to thank again our sponsors for supporting this work, Rocky Mountain Health Plans, Accessory, and Johnson & Johnson. Thank you for making this webinar possible.
Yeah, and look forward to seeing you on June 5th for Voices for Healthier Minds.
Thanks,
Thank
everybody.
you, everyone.
Thank you all.